Good afternoon, everyone. I hope that you're all safe and healthy during these difficult times. As you get ready to open your doors again and begin a more regular schedule, my goal is to help you be better prepared for the new normal. In the past, we had a program called Through the Eyes of the Patient, where we shared photos or videos of your office through the eyes of the patient, so that you could understand things they were seeing that maybe you didn't realize. With all of the new recommendations coming out from the CDC and OSHA regarding PPE, infection control, and so forth, I believe it's a perfect time to revisit Through the Eyes of the Patient and discuss what patients may be asking about, looking at, and wondering when they come into your office now. Patients have become highly educated on this subject now that they are staying home every day and watching or reading the news more frequently. So there is a good chance they will be asking questions and looking around more than they ever have to make sure they feel safe and protected in your office. As we go through these photos of various parts of a typical dental office, I may be pointing out things that are not necessarily related to COVID-19, but are worth thinking about. I personally believe patients are now more inclined than ever to expect their dentist's office to look very clean and modern. I realize these are very challenging times, and in no way am I trying to sell you anything right now or asking you to go buy something right at this moment. This is simply meant to educate you so that when the time is right, you will be better prepared. Let's start with the reception area. As I'm sure you have heard by now, COVID-19 can live on all types of surfaces for days. In this first picture, I would like to point out the carpet. Carpet in a medical or dental environment is not recommended because of the difficulty in keeping it clean and disinfected. Now with the added layer of COVID-19, carpet may not be the best choice for anywhere in a dental office. As an example, I've included this same reception area with a vinyl plank floor, which is much easier to keep disinfected, and as an added benefit, it looks much more modern. Sticking in the reception area, I'd like to move over to the next topic, paper charts. So how do you disinfect a paper chart or any of the items inside of it? I don't think it's possible. How many people are touching the paper chart? How do patients feel about it? I think this is a great time to consider moving over to a paperless or near paperless practice. Consider this. You can put barriers on a keyboard, mouse, and monitor, which is all you need for paperless dental practice. Even if you use iPads for check-ins or entertainment, you can use a cleaner or barrier for that as well. As before, I have included a picture of the same reception area remodeled with no more charts visible. Again, this is a much more modern and clean and inviting reception area. Let's move over to sterilization. The easiest thing you can do right now when you come back is to get rid of your cold sterile. Cold sterile disinfectants like biocide do not kill COVID-19, so I would highly advise you move over to items that can be sterilized or disposable items. And if you must use a cleaner, use something like Hu-friedy, which is listed on the EPA's list for registered disinfectants for emerging viral pathogens and human coronavirus. The next item I'd like to discuss is the sterilizer. One thing I often see when I visit offices are overfilled autoclaves. This is the perfect time to review with your team the proper protocols for using your autoclave and follow the manufacturer's recommended guidelines for the maximum capacity. If autoclaves are not being used properly and being overfilled, then successful sterilization might not occur. As a reference, I have included this chart for an M11, which shows the maximum capacities for a Midmark M9 and M11. If you would like this information for your specific autoclave, just let me know and I would be happy to help. The last item I'd like to discuss regarding sterilization is the workflow. Does your sterilization area go from dirty to clean with all of the proper segments, cleaning, preparation, sterilization, and storage? I've included a few images here for your reference. Obviously, your sterilization area may look different than this with various sizes and shapes. However, the main consideration should always be that you are going from dirty to clean with no need to crossover. As an example, you wouldn't want dirty instruments waiting to go into the ultrasonic to be sitting right next to the instruments on the drying rack waiting to be wrapped. Let's move over to the operatory. This is obviously where patients spend the most time and are looking around at everything. One easy cosmetic issue I see frequently that it's a real easy fix is a dirty or stained ceiling tile. Patients are mostly staring at your ceiling, and if they are seeing a ceiling tile that looks like this one, it doesn't give them the clean feeling they're expecting. Perception is reality, and unfortunately a patient could perceive your entire office is dirty just because of one stained ceiling tile. The next item I know many of you hear me preach about all the time, but I think is even more important now than ever before, and it has to do with loose instruments on a tray versus instruments in the cassette. And I should say wrap cassette. I'll skip the information about transporting instruments from sterilization to the operatory and really just want to focus on the operatory, and more specifically how instruments are presented to the patient when they walk into the operatory. When the patient walks into the operatory, which picture do they see? Do they see you open the pouches or open the wrapped cassette getting ready for their procedure? Or is everything already open and taken out ready to use, and possibly exposed for quite some time to everything in the air? Patients will be looking at this more than ever, and they will want to feel safe knowing the instruments you are about to put in their mouth are completely sterilized and have not been compromised in any way. The last thing I want to talk about in the operatory is regarding entertainment or comfort options. Things like headphones, blankets, and patient monitors. Regarding headphones, what barriers are you using? Is it even possible to completely clean these between each patient? It may be wise to suspend the use of these temporarily until there is a better guidance or until a true barrier is created. Regarding blankets, it would be wise to keep them in a sealed bag until they are presented to the patient, and most importantly, that they are washed after every patient use. Regarding patient monitors, and even in some cases staff monitors, are aerosols getting on these monitors? There's a very good chance. Are you using a medical grade screen protector that is capable of withstanding dental disinfectants like Cavicide? Or are you using a medical grade monitor that is also capable of handling disinfectants? The same could also be said about the mouse and keyboard. If you're looking for an alternative to using barriers, there are medical grade silicone keyboards and mice as shown that are completely waterproof and capable of handling dental disinfectants. I realize there is much more to discuss, but my goal for this presentation is just to get the conversation started. As a result of COVID-19, patients are now highly educated about CDC guidelines, sterilization, and infection control. When the time is right, I would be happy to come to your practice and walk with you through the front door and allow us to see the office through the eyes of the patient. Please continue to be safe and healthy, and reach out to me if there is anything I can do for you.